Did it do something?
Good.
Good morning. We're back at Center for Wellness, and today we're talking about what factors are we using in regenerative medicine. So the way that I think about regenerative medicine is a big umbrella, and there's been quite a few studies on different parts in regenerative medicine. Probably the oldest part is something called Prolotherapy. So there is a solution that's usually combined of dextrose, which is sugar, saline, which is basically salt water, and an anesthetic like lidocaine that has been used to regenerate collagen. It's been shown in scientific studies to help regenerate joints, regenerate tendons. There was actually a DO in Southern California who had an athlete who tore his Achilles tendon, complete rupture of his Achilles tendon, and he used this combination of solutions to regenerate the tendon without doing surgery. Most people, most surgeons, most orthopedic surgeons or sports doctors are going to repair that ruptured tendon through surgery, which is a common way. This patient didn't want to have surgery, so he had prolotherapy done, and it was shown to be successful. Now, that's a pretty extreme case. I'm not sure I would recommend, prolotherapy to a patient that way, but again, it was shown that it was a regenerative process. So that's one category, prolotherapy. Another category, as I think about regenerative medicine, is something called PRP. Platelet-rich plasma is your own growth factors that are taken out of your blood. We put them in a centrifuge and aspirate out or take out the growth factors and inject that back in. Now, we've done that for beautification, for joint health. We've had some pretty successful treatments with that. I could tell you about one patient that we've done it twice for his knee, and he's, after the first 2.5 weeks after the first injection, he was pretty much normal after over 10 years of knee pain. And after the second injection, he was fine for probably a year. He came back in recently for a third injection. So PRP is another form of regenerative medicine. Now, we'll have to do another video on this, but I think the most potent way of using regenerative medicine is by using banked umbilical cord stem cells and placental stem cells. Now, these stem cells are coming from patients that their lifestyle, their infectious processes have been tested, and actually the donated materials, birth materials, which before would just be thrown in the trash, now are being used in banks of biotech companies that create these growth factors. And it's really exciting what the studies that are being done, and what we're seeing clinically is really exciting in terms of these growth factors. Again, a big question is, are there fetal? No, this is not fetal. Fetal stem cells are not allowed in the U.S. They're not allowed in most countries. These biotech companies are really have high standards for cleanliness and making sure that there's no bacteria or viruses in them, and so there's very high standards in terms of the cleanliness of these products. I'm going to have to do what I'll do right now is I'll finish this video just because we want to keep them under 5 minutes, and people, so they're not too long. And obviously, if you want to keep watching, join us. We'll do 2 more videos today, one on a little bit more on the banked regenerative medicine process, and another one on something called structural energetic technique. So if you're watching, come back and check in with us in a few minutes. And if you're not watching live, these will all be saved on our Facebook page, so you're welcome to watch them. Thanks for watching.